How we eat is not just about knowing the information, right? Nobody eats a bag of chips because they don't know it's bad.
Emotional trauma, how does that affect healing?
So one of the things that I spend a lot of time helping people with is how your emotional health affects your overall health, right? So when I published Goodbye Lupus in 2015, it's here's what to eat, here's what not to eat. The diet works. It just works. But you have to be willing to do it. So psychological health is a huge part of that, right? Because how we eat is not just about knowing the information, right? Nobody eats a bag of chips because they don't know it's bad. But it's also about motivation, self-esteem, coping skills, how well you have boundaries and can resist peer pressure, right? Food addictions and things. So there's so many different things that lead into it. So that's one thing that's really important. And I'm also a trauma specialist. I spent a lot of work, as I said, working with the homeless and helping people overcome severe trauma. And when I started pivoting into working with people with autoimmune diseases, I found that I'm still doing trauma work every day. So it turns out that depression and anxiety, and even more so trauma on top of that, creates extensive amounts of inflammation in the body and is a trigger for different diseases. Anything that's inflammatory, right? It's going to make heart disease work, it'll make cancer worse, but also autoimmune diseases. And there's been studies that shown that there's much higher rates of autoimmune disease in people with emotional trauma. So the other thing that I find is emotional issues, again, can stop people from staying motivated and on track with their diets. That's why I created programs like Rapid Recovery, where I work with people every day, because I just need to work with them until, so if they have a craving or something, they can talk to me and I can help them through it versus them kind of listening to their brain and getting talked out of it. But the other part is, if you continue to have high emotional stress, then even though you're eating right, you have a much slower recovery because you're trying to repair old damage, but you're also creating new damage. And so whenever people work with me, we spend a lot of time every day working on self-care and mental health and helping them talk to themselves in a different way and release traumas, release anxiety. Julie, who I showed there, who reversed mixed connective tissue disease, she's like, it was the first time in my life I didn't have anxiety after 4 weeks of working with you, because I helped her figure out a different way to look at life and a different way to plan for things versus fear things. So when I can help people get happy, then the nutrition works just as quickly for them as everybody else. So for me, I'm all about whatever it takes to get people well. And between my background in trauma and my background in medicine and my unique understanding of nutrition and cellular biology, I'm able to combine everything together to really help people get better so quickly. And that's why people's results are so fast, right? Is we are giving them anti-inflammatory lifestyle, anti-inflammatory moods, anti-inflammatory nutrition, and extreme oversight. And when we do all of that, it's amazing how well people can get in such a short period of time. Join our free community by going to smoothieshred.com and be with other people who are just like you, trying to get their health back and support each other through the process. We'd love to see you there. smoothieshred.com.